You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, big topic, for those of you that are suffering with TMJ pain, if you have sleep apnea, if you have migraine headaches that you don't know what the cause is, maybe neck pain or any type of facial pain, you have to hear what my first guest has to say. He is known throughout the world, literally, for taking care of TMJ problems or TMD dysfunction of that joint. So with us we have Dr. Steve Olmos. Dr. Olmos, welcome to the program.
Thanks, Randy. I appreciate you having me.
Good. Now, lots of questions. I have a stack of questions, but what I said is true. I mean, you are known internationally, all over the world. You have more than 64 centers. You've had them in Dubai. You teach. Your name comes up, of course, with me because I'm in the business. I interview doctors for a living, and you are the guy that they always reference or talk about. So for people that don't know your centers, I guess you are the founder of the TMJ and sleep therapy centers across the country.
International.
International.
Yes. We're in 7 countries. So we're throughout the US, Canada, Australia, New Zealand, the UK, in Dubai, and Bahrain.
Is that right?
Mm-hmm.
And you treat TMD problems differently than most dentists. Is that fair to say?
Yes.
You look at it differently.
Yes.
Most dentists. And I'll start with the big thing is most TMD problems, when the doctors come on my show, they say it's a teeth problem, a tooth problem, that the way the teeth are coming together improperly. So they may ask you to spend $50,000, $80,000, kind of crown or cap all the teeth to give your bite in a happy position, to relieve some of this tension off the nerves. You say that that's the wrong way to think about it, and I'm paraphrasing you slightly. So tell me why it's not a teeth problem and a bite problem.
Well, because as dentists, we're oriented everything around teeth. So therefore, teeth must be the reason for the problem. And so therefore that must be the solution. There's this thought process that we just have to find this perfect bite, and then everything gets better, and the clouds go away, and the sun comes out, the flowers grow, and everything's wonderful.
Okay.
But in reality, there are problems. And so the origin of injuries to the jaw can be traumatic, a blow to the face, car accident, something like this. But usually, if you don't heal from that, there's an underlying problem. There's a repetitive movement, usually when you're unconscious, that continues to stretch and irritate.
Okay, so
things.
let's say you jar your jaw in a car accident, or even a minor fall off a horse or whatever. It's like going out of place, almost like dislocating a shoulder or knee or whatever.
Sure.
And so you treat it like an orthopedic problem in a way?
Well, it is an orthopedic problem.
Okay.
It is an orthopedic problem. If you stretch ligaments limit movement.
Okay.
So they connect the bones together. And when they are stretched further than they should, then there's too much play, so things go in and out. So the simple solution, and sometimes with these traumas, is just an injection. We do proliferative injection that accelerates the healing and tightens up the ligaments. So it basically undoes the stretch. So sometimes people come in and just fall down and they have these injuries. One injection or two is enough to take care of that issue for them, get them back to where they were.
Is it like PRP? Is it stem cells? I mean, what's the cocktail?
No, we use proliferative therapy, Prolotherapy, if you're familiar.
I am.
It's about using a very mild irritant in an area that is chronically inflamed. So tendons and ligaments, unlike muscles, don't get a big blood supply. So after an injury, they're the last ones to heal. So by stimulating with just a very, very mild irritant, then you're able to turn a chronic inflammation into an acute, and now you start the healing process.
So your body is kind of like what they do with stem cells. Your body is sending growth factors to that area.
That's right.
Healing properties to heal it.
Right.
Really?
But what we use as an irritant sounds weird, is sugar. We use dextrose, so a very watered down dextrose. Body doesn't like sugar very much, and so it's an irritant. And you put it into these areas, and then you get an inflammatory response. And usually after about 2 weeks, 80% of the healing's occurred. And usually the inflammation is gone, if not sometimes 2.
Is that a better treatment for people that they've only had it maybe at 2 or 3 years? Or could you have it 20 years and still
Well,
this
it's
may
more
work?
related to a person who's had an injury, okay? Or or there's been a long-term underlying problem. See, if you have an injury and you don't have an underlying problem of your jaw moving while you're sleeping, then it's going to heal, or you could use this technique we're describing. However, if there's an underlying problem, then that the person wasn't aware of, and then that's why they don't heal. So you see a lot of these people who get in a whiplash accident and this sort of thing. They didn't know they had this kind of an issue, or maybe they thought just grinding of their teeth, and that's treated with a night guard, that took care of the problem. But they're not understanding that inflammatory problems of the jaw create postural problems, okay? And that adds to aggravation of cervical and lumbar spine issues.
So help me understand, how is it that when you fix this jaw that's out of line, in a way, right? How does that have anything to do with a migraine headache? Or a cluster headache, or some of these other...
Okay, so those kind of headaches that you're describing are called primary headaches. That means you don't have an organic reason for the headache. You don't have a tumor, you don't have bleeding, in your brain. So there's no surgery that's going to correct that. Those are usually vascular or muscular headaches. So a tension type headache is like something like this. So a person wakes up like this, but that's them clenching all night, usually because they're mouth breathing. Their nose is obstructed, so they have to use their mouth for breathing, which is abnormal. And these muscles get tired holding that separation because it's abnormal. So they contract in order to because of all the inflammation and the lactic acid that's building up in those muscles, they contract. So they breathe, they contract, they breathe, contract, going back and forth. By the time they wake up, they have what's called a tension headache. That's different than a migraine. A migraine means the blood vessels in your brain dilate and they press against the nerve endings, and then that's the headache. But that means you're systemically inflamed. And usually that's a digestive issue, something called leaky gut, where the inflammation gets out into the vascular system and your whole body's inflamed. So one of the big treatments that we do in addition to the local therapies is nutrition supplementation.
Like putting them on an anti-inflammatory diet.
Absolutely.
Interesting.
Because that systemically, not only is it the migraine, but also the general achiness. And listen, I was a migraine sufferer for most of my life, and
really?
I was on my migraine formulas for a really long time. I used to have to cancel my patients at 2 o'clock in the morning because the weather changed. So I come to figure out exactly what that was. I was just systemically inflamed. Changed my diet. Huge. I had a breathing problem. I got that corrected. And I've been hypertensive since I was 20 when I got into dental school. Yeah. And now I'm off my antihypertensive meds. I'm off my migraine abortive meds. I'm 66 and I don't take anything except vitamins.
Is your story common with some of the people that have gone through your program, your protocols?
Well, if people...
do you hear stories like that?
Well, yes, that's what I do every day for my patients. If they adapt to the changes, if they commit, what I tell them is, listen, you can't keep doing the same thing and expect a different result. You can't keep eating the same thing and then complain about how bad you feel. Okay. It's a life change. It's not a diet. It's a lifestyle change. If you're willing to make those efforts, then your life will be different for the better. And I'm proof of that because I pretty much had everything that I treat people for.
Is that how you got involved in this?
No.
To try to figure it out for yourself?
But along the way, I was suffering from a lot of the things that I was helping other people. Then I come to realize, well, I'm a chronic pain person. And those of us are more susceptible to inflammation than others. That's genetically predisposed.
So let's start with this TMJ, TMD problems. And what is it? TMJ, TMD, what's the difference? Give us a working definition.
TMJ is temporomandibular joint, so it's just the name for the structure. So someone saying that I treat TMJ is like saying I treat elbow. That's nonspecific. It's orofacial pain, craniofacial pain. Those are terminologies of an orthopedic problem of the jaw joint itself. But you also have muscular problems of facial pain. You have primary headaches like you were talking about. So there's all of these things all at the same time. And people lump that into a basket and call it TMD, but that's not really a diagnosis.
Okay, so the D stands for what? Dysfunction? Disorder?
Yeah,
okay, dysfunction.
It can for either. Everyone has different interpretations.
And so let's go over the obvious symptoms. Somebody watching this, what are the obvious symptoms that you have a problem with the jaw joint?
Well, it shouldn't make noise. I mean, if you move your arm, it shouldn't make noise, neither should your jaw.
Okay.
And if it does, then there's an issue. Now, it can be something that doesn't hurt and people just live with it.
Like popping and clicking?
Exactly.
But even every once in a while, that's bad? I think that happens to me a couple times a year right here. So that's not good.
Well, it's never good to hear noises out of a joint, okay?
Okay.
Any joint, okay? So if there's an underlying problem. Now, whether or not that needs to be treated, that's a whole nother, situation, but it's not normal.
So what is the popping? I mean, what's causing that noise?
The popping is a dislocation. So it can be, a lot of people have reciprocal popping or clicking. So they open their mouth, they hear a noise, they close their mouth and they hear another noise.
Okay.
Well, that means their jaw's dislocated. So there's a disc between the lower jaw and the skull. And in those situations, the tissue is displaced. So their jaw's dislocated. And when they open, it pops into place. And when they close, it pops out of place.
Interesting.
So I tell people, if your jaw's making these noises, well, just know that it's dislocated.
And you're kind of headed for disaster. And I guess, look, I interviewed...
May or may not.
I interviewed one of your, the people that you taught about 20-something years ago, on my show. And he was saying that, it's like if you hurt your arm, you wear a cast. But if you hurt this jaw joint, you're still opening your mouth and closing it like 2,000 times a day. So it really never gets a chance to heal. Is there truth to that?
Yes. In most joints, as you say, you can isolate them. But the one thing that the jaw itself is an issue, and allows us to treat it, is that we have a rigid endpoint of contact, we say, and that's your teeth.
Okay.
So you can't go past that point. And but it helps to be able to stabilize these unstable situations and take the pressure off, because the real problem isn't as much the noise as it is the inflammation. That's what's going to cause you to have symptoms. So if you have noises but it's not inflamed, it's just an annoyance. But if you have inflammation to the point where now the muscles contract and now you have facial pain or joint pain, and to a degree, then you're going to actually have postural changes, okay? So think about a really bad twisted ankle and how your gait would change if, favoring it.
Okay.
And so it'd be the other side that hurts, not the side that is actually injured. And that's very often why people get surgeries and things and they don't get resolution of their symptoms. That's the thing about chronic pain. It hurts on the opposite side of the injury, okay? In acute pain, recent pain, it's going to hurt on that same side. So that's where we have to have an understanding about that. So let's say a person wakes up and their face is hurting, their jaw hurts, and so now they go about their day. Every time you swallow, your teeth come together, and that's the furthest this jaw goes up into your head. And a person swallows around 2,500 times a day, so that's a lot of poking.
Wow, okay.
So what you do, instead of like your ankle, leaning over, you lean forward so the jaw can hang down away from the inflammation. And
it feels better.
And for every inch, because you're not compressing it. So for every inch your head goes forward, it adds 10 pounds of weight to your cervical lumbar spine. That's why people always have neck aches and low back pain. So I published a study on uprighting people's heads using appliance to decompress the jaw many years ago. And we demonstrated that on an average, we had 51 patients, 13 to 74 years of age, and we were able to get their heads up about 4.43 inches.
Wow.
So that's essentially taking 45 pounds of weight off their necks and backs, and that's on average, and it didn't matter what the age group was.
So TMJ, you're treating, for people just tuning in, you're treating it as the orthopedic problem it is.
It is.
It's a joint problem. Okay, so back to the popping and clicking. Okay, so it's out of whack or out of place. How do you get it back?
Well,
through manipulation, through splinting, what?
No, the only way to try to attempt to get structures back to their original position, or whatever, as close as you can get them, it matters the degree, how far it's stretched out of shape. So is to unstretch it, okay? Well,
unstretch what?
The stretch out ligaments. For everybody that has these noises, they have what's called ligament laxity. That means they've stretched out the ligaments that kept these structures in place.
Okay, makes sense.
Now that either happened with a blow, or that happened because of repetitive motion while they're sleeping. Okay. And why sleeping is such a big deal over than the daytime is that we bite 5 times harder when we're unconscious than we conscious. See, the way you feel when you bite, that's called proprioception. That goes to your brain, your cerebrum. So you know how hard you're biting. You can stop yourself. That's biofeedback. Oh, gee, why am I doing that? I'm biting too hard. Okay. But then at night, it goes to your brainstem, and you have no awareness. So you can bite till things break. Teeth, jaw gets injured. That's why people wake up with these kinds of issues.
Is that why their teeth get flat sometimes?
Well, that's just the repetitive motion. What I try to do is find the origin of that. Okay. Why is this happening?
All of your centers run this way.
Yes.
You have 64 centers.
Yes.
So they treat
65.
it as a, and what do you guys, like behind the scenes? I mean, I'm calling it an orthopedic problem. What do you call it?
It is an orthopedic problem.
So that's what you call it?
It's
a joint problem.
Well, a joint, yeah.
A dislocated.
Well, it can be, but not all are dislocated. It's an acute inflammatory problem. I like to say, we treat itis disease. We treat inflammation, okay? So whether it's in a joint or in the muscles that move the joint or in the nerves that innervate those muscles, there's inflammation. So if it's a nerve, you call it neuritis. If it's a muscle, you call it myositis. If it's a jaw joint, you call it capsulitis. But it's itis. That's the disease we're treating.
So you have like a 10 to 12 week program that you put people through, and then you wean them off so they don't have to go back to you, I guess. Tell me about that.
Well, there are certain people, and not all of them, but there are certain people where the inflammation in the jaw joint is so great that it produces those postural problems. So that means they have daytime symptoms, okay? So I tend to separate the person who wakes with a headache as opposed to the one who develops a headache later in the day.
Okay.
Okay, so if it's later in the day, that's usually some kind of orthopedic problem. And so we try to understand exactly, how to treat different people. And there's some people that only need assistance at nighttime for prevention. There's other people, like this category that I'm speaking of, that need decompression both day and night. Okay, so it isn't everyone. I mean, there's sometimes a solution, as we were saying earlier, is just an injection for certain people that just injure themselves. They don't need any appliances.
What are your thoughts on Botox? Because I know somebody that they swear by Botox, and they have a lot of popping and clicking.
Well, I try to make this analogy to the patients. Say, listen, you'll probably get some temporary relief from this procedure, but I think it's a lot of the same mechanism. Let's say you're driving down the road and, the engine light comes on your dash, and you have two choices. You can pull over and go to, your service station or who's taking care of your car to figure that out, or you can just pull the wire out of the sensor and just keep driving. Okay, so that's the alarm. The Botox that you're getting is covering up the alarm, and the alarm is the facial muscle pain that you're trying to get relief from.
Okay,
that's the red flag that says something's not right, but we're not going to spend any time to figure out why. What I try to do is figure out why.
To fix it rather than going to the underlying cause.
And then you get a cascade of relief of symptoms. And it works, believe me, it works so much more easily.
When you say cascade of relief, because we've done some talking on the phone, we're talking about not only does your jaw pain go away, your migraines may go away, or your headaches may go away, your neck pain goes away, you feel better, you sleep better.
That's
what
the goal.
A cascade?
That's the goal. It's the orthopedic changes. So I like to tell people we're working externally and internally because there's inflammation on both ends. And so we have to address all those issues for a totality of improvement.
Okay, now I know this is a big topic, and we could spend, you spend weekends talking about this, and we only have like 35 minutes together. But just the fact of the matter is, it seems like 95% of all dentists are treating it as a teeth problem. That it's just, you basically give them a mouth guard and send them on their way in a way. Or you crown all the teeth to just make it a more comfortable bite. And you're saying that that's kind of old thinking, wrong thinking, all of the above?
Well, it's something I've evolved from. There was a time where I thought, like, most dentists, because we're trained to orient around teeth, that there's some ideal relationship that everybody should have. And once you have that, all problems go away. The
relationship meaning your teeth coming together. You have to find that happy place, as they tell me.
That's the nirvana syndrome, yes. And so early on, I had the thought process the same. I would make appliances and decompress the jaw. People would get better. And my thought process, then that must be the perfect relationship, so I should move the teeth to that point.
Okay.
And so I did that for a while. And then I come to realize that No. What I was actually doing is just changing, because I would do expansions of their jaw and do things. And then I come to realize all I was doing was increasing nasal volume so that they could breathe more properly. Okay. And so, and I did keep them comfortable, and they were better at the end. But now I've come to find out that really what a lot of these problems are improper breathing. You know, we have so many people whose jaws are not developed enough. That's why they need to go to the orthodontist, okay, to straighten them out. Well, the reason they're crooked is because the tongue is pushing on these bones because they have breathing problems. And the tongue goes against the lower teeth when you're mouth breathing, goes up to the roof of your mouth when you're nasally breathing. So people aren't developing.
So
and that's
your
why they have
treatment
nasal
helps
problems.
people become nose breathers?
Well, that's the whole idea. But I work with ENTs.
Okay.
See, and that's why once we restore, from the day we meet them, we get them using nasal sprays, dilators, we're restoring proper function, and a lot of them have their throat closing. So that's obstructive sleep apnea. And so very often those people have facial pain and the ground down teeth that you were talking about, because you're constantly having to move to open your throat, or you can't breathe, so you're clenching.
So it all goes together.
And so
like
that's
sleep
what,
apnea, chronic snoring.
That's what we're seeing. So because there's a really high, what we call comorbid relationship. So I published a paper on that for the pulmonary journals explaining those relationships. I just submitted a paper from about 13 of our centers, about 1,400 patients, showing that simply just having nasal valve compromise, this cartilage here being pinched, it has a 7 times greater risk of having facial pain. So I am seeing that most of these problems are really respiratory in the absence of getting hit in the face. Okay? The underlying problems, and that makes sense because why are they unrelenting? You know, we want to say it's all stress, really. There's good times, you know, that we have too, not just always bad. But how come these problems persist, you know, regardless of level of stress? There has to be an underlying mechanism that's not proper. And now we're finding that using night guards on people that have breathing problems makes the breathing problem 50% worse. So
what's the answer?
Well, we use devices that connect the upper and lower jaw. See, a night guard just covers one set of teeth, and the lower jaw can still fall back. And if your throat closes, then now, you know, it can still fall back, but you have this piece of plastic in there, so the tongue is now forced even further back, and that's why we see an increase. So we don't use night guards on people that suffocate, okay? Because it makes it worse. You asked me why we do this for 10 to 12 weeks. Well, because from the start date to 10 to 12 weeks is to shrink the inflammation. So we use very sophisticated lasers.
From these stretched out ligaments.
Yeah, and so we try to unstretch. We're trying to unstretch them. So at first we reduce the inflammation. We use laser techniques and things like that. And then you get to a point where the pain levels are down, and now you just have local inflammations. And then I usually switch to the proliferative injections that we talked about. So you get the pain levels and structure stabilized, and now you don't need the appliance to hold the relationship. You just have to maintain breathing.
So after 12 weeks, you don't have to wear a splint
a daytime appliance.
Just a daytime appliance.
But sometimes people have to wear a nighttime one until if they don't have apnea, I refer to an ENT, you know, and the ENT then corrects the nasal problems. Now the person can breathe, and then there's other categories of people. It's not all breathing, but sometimes they have their brain's active at night for different reasons. And so we do sleep studies, and then, you know, if they have limb movements and this sort of thing, restless leg, that's in the same category as grinding your teeth. Grinding your teeth is a movement disorder, like restless leg and periodic limb movement. So sometimes there's medications and things that have to come in. So there's a lot of factors. It isn't just as simple as people want to make it to be. It's so easy just to say, oh, it's just stress. But that has not been what I have found for the last 40 years.
Now, you know, many years ago, I went through a stressful time. I was going through a divorce. And I remember I'd wake up with sore jaw all the time.
Oh, absolutely. Absolutely. There are times.
So what's going on there?
Well, no, that's absolutely true. That stress certainly is an aggravator.
Is it because I'm clenching or something in the middle of the night?
Absolutely.
Possibly?
Of course you are. Of course you are.
So it's the
you have
clenching.
disturbed sleep. you have disturbed sleep, and probably during your REM sleep.
So for somebody like that that's going through something, they could see you and you can help them with that?
Oh, well, that's what we try to do.
So snoring, is that an easy one for you? Like if somebody's just a chronic snorer?
Well, yeah, but we also, snoring is also a symptom of obstructive sleep apnea. So we'd have to get a sleep study to see, is it just snoring or is it snoring plus suffocation? Now, so we treat both, okay? And sometimes you can treat them simultaneously. And other things, you need to have proper nasal, sometimes an appliance. Sometimes we have to take the tissue using a special laser that tightens up the tissue and grows. That's why people, the snoring and the apnea is that the muscles of the throat are too flaccid and they close. So we can use lasers to tighten them up, okay? And that really helps to decrease the snoring. Sometimes we don't even need appliances to do it that way. So.
Is that right? And sometimes this can be done in 12 weeks on your 12-week protocol.
Oh,
and you're doing CT scans. I mean, you're doing this scientifically.
Oh, absolutely.
You're doing these home sleep studies.
Not just that. We measure flow rates of the nose. We measure the volume of the throat. I publish papers on how to find the position in order to treat these airway problems too. So yes, we use technology on every aspect.
Now you have like, I don't know in all of your centers, but you have like these fancy digital printers that are making custom made appliances right there on site. Is that right?
Not on site. We have a laboratory that makes printed appliances.
But it's your laboratory.
Yes.
Okay.
Yeah. And we have an FDA-approved appliance for apnea. We have other appliances that are for chronic pain situations. So, but they're all printed. Yes.
Okay. Let's talk about the money for just a second. You told me. I said, what's the range of what you're charging? That seems to be about 90% less than what I'm hearing across the country. And I interview at least a dentist every week, okay? And it seems that, to rebuild a mouth, to get the right bite, in some cases, 70, 80,000, 90,000. My friends that watch this, that are doing this, may not like this, but yours is a lot more affordable. And you're not really having to mess with the teeth, you're treating the joint.
Yeah, these problems don't have much to do with teeth.
Really?
Yeah, absolutely, because if the reason why my jaw's moving at night, my teeth are wearing down, is because I'm suffocating, those teeth were at a proper height at one time and they've been ground to this. Okay. So if you make them back to the way they were and you still have the suffocation problem, you're just going to be right back to where you were.
That logically makes sense.
So what was the purpose? Now if people need restorations and get their teeth fixed after our treatment, well, so be it, great. But it isn't the reason for doing that because they're asymptomatic.
When you say it's not a teeth problem, I guess some expert would say, well, he's right, it's not a teeth problem, but it is a bite problem.
Well, it may not be a bite problem.
Okay, because that's what they think, right? That's the belief.
If there's wear and the symptoms have been relieved, whatever they were, and they still have these worn teeth, well, now it becomes more structural. Are those teeth going to break? If they're not, then it could be cosmetic. But you're not going to change the teeth to improve the function of the symptoms because that had nothing to do with the issue. The breathing problem predated the ground down teeth.
Okay.
So you got to, and even after you make those teeth new again, you still have to treat the breathing problem. And you have to treat it the whole time that you're making the teeth because you can't let them suffocate on any night while you're going through this process.
You say it's just logical. But a lot of, you told me a story right before we started. You said I could go to Costco and explain what I do, the treatment of, reversing, popping, clicking, jaw pain, headaches, things like that. I could explain it to somebody at Costco, but I have a tougher time tell the story.
Exactly. I have a tougher time explaining it to dentists because we were indoctrinated with a philosophy and a thought process, and the average person isn't. So if you can make logic, if they can follow your logic and it makes sense, which it does, it isn't difficult for people to grasp exactly the concepts.
Okay.
There's only if you already have a bias, then you have to unlearn to learn sometimes.
And so what if somebody is watching this and they've already, they did it the other way and they're slowly starting to get problems again or symptoms again. you work with a lot of those people?
Oh, yes, quite a bit, yeah.
And do other dentists send you people, and do medical doctors send you patients?
Yes, in fact, most of our referrals are from dentists.
Okay. You know, because, you know, I was interviewing somebody about TMJ, and this is after I talked to you on the phone probably a month ago, and they said, well, you know, I went through the, you know, I studied under, and he mentioned your name, like he's the guru of this, you know, in the world. I said, I was excited. I said, yeah, as a matter of fact, I'm interviewing him next week. So this is all you do. So if I go to your office, I'm not going to get cleanings. I'm not going to get ortho.
No,
I
stopped doing general dentistry 25, 26 years ago.
So all of your centers are basically just focused on TMJ problems.
No.
And sleep disorders.
No,
snoring.
Some are and some aren't. Basically, we have dentists of all specialties as owners of these centers. So root canal specialists, periodontists, orthodontists, you name it, you know, they have all the different specialties, including general dentists. And I don't make an absolute about how they have to practice in terms of the amount. I tell everybody as I go through training, listen, I don't care if you do this stuff 1% of your day or 100% of your day, but what I do care about is when you do it, that you do it to the level that we do in our office here in San Diego.
Because this is completely 180 or even 360, completely different than how it's typically being treated.
Yes.
And how, you know, I felt like going into this interview that I knew a few things about this. I go, I know this topic. And then I talked to you, you know, the so-called legend, as they call you, behind your back, right? Probably in front of your too, but that it's a joint problem. So treat it that way. Well, it's an inflammatory problem.
It's an inflammatory problem.
Because jaws aren't connected, right? I mean, this lower jaw is like floating.
Well, it's held in place by muscles.
By muscles and tendons, or just muscles?
Gravity is pulling on everything all the time. So muscles have to have tension to hold a certain position. So otherwise, if there wasn't, there's little sensors called muscle spindles in these muscles that close your mouth.
Yeah.
And they're always sensing gravity. So if you didn't have them, you'd be walking around like this all day, and you'd have flies, and it'd be a real mess for you, okay? So there's always tension. So now you add injury by repetitive injury all night long, and now you have the tension from just function, and that's more than people can deal with.
So you seem to be breathing okay, you're not grinding during the day, but you've got some kind of TMJ problem, right? Then you go to sleep, you're kind of unconscious or sleeping, and now your mouth is totally uncomfortable in the wrong position. It's kind of like trying to find a comfortable spot?
No.
Again, because that's what I've been taught again.
Again, it has nothing to do with teeth. It has to do with what function is not working properly. So again, what I found is the nasal valve in the nose itself on most of these people is dysfunctional. Okay, and so they're adapted to their bad breathing. They don't know that they can't breathe through their nose until I show them an X-ray. That's a big joke with ENTs. I do a lot of lecturing with ENTs, and the big joke is never ask somebody if they can breathe through their nose, because everybody on the planet will say yes. And then you look at the X-ray, and it's a solid mass of tissue and bone. Okay, and it's just that. This is what I tell patients all the time. I go, look, it's like this. You have nothing to compare to. You've never been in somebody else's body where everything functions properly, okay? And so I give them a little taste of that, and I spray their nose and dilate it, and their eyes get big, and they had no idea.
So they thought they were breathing through their nose, but they really may have been blocked like 80%.
They were just used to them. I tell them, I think of this like when I was a kid, and you know, we had chalkboards back then, and I couldn't see, so they said, you need glasses. And I remember the first day I got my glasses, and I was in the backyard just looking at trees, thinking that those green blobs, those are actually leaves, okay? Up to that point, I thought, everybody just saw blobs, okay? So that's your point of view until you're shown something different.
So do you have patients that go through your program, they've been through other programs, and they're happy, they're relieved, but they're almost frustrated at the path? Do you get that?
Yeah, it can happen. You know, I mean, the whole goal is to get people better as quickly as is possible.
You know, as you're talking here, I'm thinking, you know, dentists are in a great position to be able to help people like this. Because if you're a primary care medical doctor, you know, a lot of this stuff isn't addressed. But a dentist across the country, there's like 350,000 of them, they need, since they're graded, they could potentially become the diagnosticians for this. And then they could send them elsewhere, but do you find patients sometimes, especially, they're going, I just have a little popping and clicking, or I just have, every once in a while. Are a lot of the early patients, well, because nobody likes going to the dentist, right? Or the doctor in general. Do you get a lot of people that are just, they wait and wait and wait, like most guys do? We wait until we're in so much pain we can't handle it anymore.
Yes.
Is that everybody?
That's a lot of people. I think for everything. I mean, if you have chronic headaches or pain or something, you don't go to the doctor first, you go to the drugstore. And if something at the drugstore doesn't help you, then you go looking for it. And so I think it's a lot like that, I think, and I also think, this whole area is kind of a black hole for dentists, okay? The training we had, well, because the training we had was very superficial. It was really about acute situations. If somebody hurts themselves, we know to give them NSAIDs for a couple weeks, maybe give them some little appliance or something. But if the problem lingers past that point, now you've got 4,000 different treatment options. You were mentioning some of them.
Yeah.
And that's where all the confusion, it's the chronic problem, not the acute. And that's where everything goes haywire. So everybody has their philosophies and their thought processes.
So you publish papers. Is this approach and philosophy to treating joint disorders, is it becoming more mainstream all the time?
Well, I think...
are there any outspoken people, like supposed these geniuses in dentistry, that are saying what he's doing is just off?
No, I think early on, people certainly thought I was crazy, for sure, because I was talking about postural changes and things like that, and people would ask, is he a chiropractor or a dentist, Now we understand that even in our dental literature, orthodontic literature, that the worse your apnea is, the more time your throat closes, the more forward head posture you have in the daytime. So suffocating at night lends to changes in postural.
And what does that lead to?
Problems with your neck and back. That's why people are getting neck fusions and lumbar fusions. No one's thinking that the problem's up here, not down there.
Do you have like every single week reversals in symptoms?
Absolutely.
Like every single week? And to a patient that's
every day.
Okay, so every single day. I mean, to these patients, for them, look, we've all had, I'm sure anybody watching this has been in pain at one time or another. When you're in pain,
sure.
You're not in the mood to watch TV, play with your kids.
Oh, no.
You don't want to start a new business. You don't want to, listen to your spouse when they're talking. You're impatient, you're edgy, you're snappy. Do you have people that literally, because this is also an impact on the family, that you fix, and it's like almost like their life changes?
Well, that was yes, and that was something early on with my staff. When I first started to do this, I remember years ago, why do you want to do this? I mean, that Mary, she's just such a mean person,
Okay.
And I said, no, she just doesn't feel good, and she's tired. She hasn't slept in years. She's just fatigued, she hurts, and she just can't take it anymore. And so you see these people transition. I tell them it's like we're going to pull the thorns out of you. And as we pull more and more thorns, and they get more restful sleep, their whole demeanor changes.
Really?
Yeah. Oh, it's a trans. Well, just think how you would feel if you had I could change your whole day by putting a rock in your shoe, and let you walk around on that. By the end of the day, you'd be miserable. Okay. So chronic pain, for sure, it's a strain, it's a stress to your system.
So the biggest thing they experience is they're out of pain.
Yeah, well, you reduce the pain or hopefully eliminate it. Yeah, that's the goal.
You have a lot of elimination stories of people?
Absolutely. You can go on our website and look at all the testimonials of all the people who... It's not just that. It's the cardiovascular changes. We have a lot of people with heart conditions, atrial fib, other kinds of things that no one, even their doctors, weren't looking for them in terms of their breathing. A lot of these people have obstructive sleep apnea, and we treat their apnea, then their cardiac conditions improve. So there's all ramifications of different...
This whole nose breathing thing is almost like a topic for another show. But there's books now about, our Olympic team is talking about nose breathing. I mean, this nose breathing is a movement that's going on. I guess the people in the know have always known about it. And now it's interesting that there's a connection with this and TMJ problems.
Well, yeah, that's what I'm trying to do right now. I lecture with ENTs, and because I'm trying to show them how the nasal obstruction affects body posture so they can understand, and then of course and facial pain. So that's why we're publishing these papers, so that we want to educate the ENTs that not just respiratory function, but also the consequences to the rest of the body that they may not know. And so that's what we're publishing right now. And we're trying to build bridges across the board. Right now we're doing a study with Harvard on a visual screening tool for children to be able to identify kids that may have apnea. And these are all different kinds of malocclusions and cranial structures that we're going to validate this year so that dentists, when they have kids come in, they can look at this and then they can refer back. You know, we have ENTs here at Rady Children's Hospital that are doing nasal surgery on 3-year-olds because we identify breathing problems. The sooner you get to the problem, the better the quality of life. Everybody that has apnea was born that way. It just gets worse as you get older because as you get older, you lose muscle tonus, collagen.
Do the experts agree with that?
Oh, absolutely.
So apnea is just not developed?
No.
It's because of a narrow airway? Or
it's a structural,
problem.
Half of it is your response to CO2, neurologic, and half of it is a structural part.
Okay.
And so you have to address both sides, yeah. And sometimes physicians will do it with medicines. You know, dentists can do developmental stuff, and there's a lot of techniques for handling it.
Okay, so do you live in a little bit of a frustration that, you know, dentistry is going about it and treating it like a teeth problem?
Well, earlier, you know, we were talking about, you know, how crazy are these ideas that are being. Well, what I see is that the things that I've been talking about, literature is coming to the point where everybody's starting to see things in a similar way, you know, and I think it's just a little bit longer before people will connect these dots and the philosophy will change.
So medical insurance, does that ever cover it? And I guess dental insurance, max payout's about $1,500 a year anyway, so it covers a small portion.
In a dental?
Yeah.
Yeah, well, there's nothing really that we do that's dental.
Okay.
Everything that we do is of medical necessity.
So can they bill their medical insurance
in some
cases?
Yes.
So you take medical insurance?
Well, we assist people in billing their medical insurance.
To get it done.
Like if you have a breathing disorder, okay, well that's covered with your medical insurance. It depends on your medical insurance in terms of how much they cover towards craniofacial.
If the ENT possibly refers to you, then it may be more likely to be covered?
No, it's anyone who diagnoses OSA. A physician diagnoses it, and then a dentist can treat it, okay, if it's obstructive. And so the things that we do, appliances, combination with positive pressure, things like that, that's all billed.
Yours is a lot less expensive way. I'm going back to the money, but it's a lot less, you know, I have a personal friend with popping and jaw locks every once in a while, she says, a couple times a year. And, you know, she's been quoted like 60 grand to rebuild her whole mouth, her teeth. And now I'm going to actually send her to you because you say it's not a teeth problem. It's a jaw joint problem. So if you fix the jaw joint, the symptoms go away. If
you fix the origin of what's wrong with the jaw joint, then, and you control that, then now you can decide what you want to do with teeth or not.
Okay, good. So we're out of time, but somebody watching this and they've heard what you had to say, but for whatever reason, they're still skeptical. Or maybe they have a loved one that, you know, spouse, a partner, whatever, that has these obvious symptoms. What do you say to them?
Well, I say if they have not been successful with the things they've tried, they don't have much to lose, but a lot to gain by letting us take a look and see if we can help them. Okay, the one question I didn't ask you that I wanted to ask you, so I'm going to have to fit this in, is so the popping, clicking, we talked about that, but what about people that all of a sudden can't open their mouth very wide or it gets locked? What's happening there? And is that treatable? Yeah. Or do you have to have surgery? No. There's so many things that I should just say that I get some of the worst cases that are walking around the planet because people fly all over the world to come to my office. And but I can say that maybe, I don't know, 1 or 2% of the people I treat need surgery. Okay. And so what is the what's happening when somebody it like locks in place for a second? Well, it's different mechanisms, but we were talking about jaw noises, that popping and clicking. So on those people, that means the disc tissue is stuck out of place, but when they open, it pops into place. So it's a matter of degree. So first it's in place all the time, it's quiet, working great. And then it gets stretched out of shape, and then now it's out of place when your teeth are together, but when you open, it pops onto place, okay? So we call that reduction. It's going back in place. But then it keeps getting stretched out even further to the point where it's so far out of place, it can't get back into place, and that's where you have limited opening. So for sure, you know, that can happen at any time.
That's an easy one to treat?
Yeah, that's the kind of stuff I get all the time. Where, you know, they're in a dental procedure, they were holding open for a period of time, their jaw locks and they can't, or they yawn and they're dislocated, they can't get it back, or they wake up that way.
But you could reverse that.
Well, that's what
I mean, you see reversals where they say it doesn't happen anymore.
Oh, well, that's what I do. That's what I do every day. Yeah.
Interesting.
Yeah. And then there's, you know, other situations where the muscle is just so spasmed that they can't open. So, but yeah, that's what we do. So we work with them to get them to have normal function. Yeah.
So an orthopedic surgeon would treat this a similar way. They would look at what's causing this problem.
Well,
that's kind of how you're looking at it.
It is an orthopedic problem.
It's not a tooth problem, teeth problem.
I learned to have a medical perspective on these things rather than a dental perspective years ago, because these are medical problems. That's why they're a medical necessity. See, I treat orthopedic problems of the jaw. I treat musculoskeletal problems, chronic pain. I treat breathing problems. Those are all of medical necessity. That's why they're all, you know, covered with medical insurance. So you have, if they're all medical problems, you should look at them from a medical perspective, and that's what I'm trying to demonstrate.
So this is a discipline of dentistry. Is there any official, do you see in the future an official accreditation, board certification?
Oh, there is.
To learn this?
Well, there are different philosophies, and the philosophy is different in some cases. We now have a specialty in this called orofacial pain. That philosophy is quite different than the kind of philosophy that I subscribe to. Although I use medications and I use splinting techniques, it's just that I don't have a need for emphasis on surgery. There's many things that I'm able to rehabilitate and get patients' pain levels down and get their function.
So oral surgeons are doing these surgeries? When people have popping, clicking, and some of the lock stuff.
We need that help sometimes.
Sometimes
that's only
I have 1%. You say of all the people, the thousands and thousands.
In my hands, that isn't
probably 50,000 plus people you've helped.
It is not a great number, but when I need them, I'm very thankful for the oral surgeons to help us with those group.
Are oral surgeons sending you people now?
Oh yes, absolutely. Have been for years. You know, very well supported with dentists, supported by all specialties. You know, ENTs, neurology, the peripheral stuff. You know, chiropractors, osteopaths, physical therapists. Yeah.
So this 12-week program, in light of COVID or things like that, can they do some of this on Zoom, or they have to make like a visit once a week for 12 weeks? To one of your centers?
No, we have people, especially during this COVID time, where we get them started, get them stabilized. A lot of them are relocating to different places, you know, outside of San Diego, or just can't leave. So yes, we do Zoom visits as well, absolutely. But if they need therapy, best thing is to come in so that we can do things to help them feel better.
Do you have a theory, you know, where, you know, 400 years ago did TMD, TMJ joint problems exist back then? Is this a new phenomenon? Is it because of stress related? I mean, what's your take on all this?
Well, I think the orthopedic problems of the jaw in primitive times, you know, were due to trauma, okay? Now, they're greater and greater related to respiratory problems, because our skeleton, our jaws are so much smaller today than they were in primitive times. And so see the upper jaw.
What's causing the shrinking of the airway in the
diet?
jaw?
We have a high carbohydrate diet.
So our diets are changing that.
And that causes inflammation. The swelling, your nose is lined with erectile tissue. It's one of the first places that swells when you come in contact with something that's inflammatory. So it closes, you start mouth breathing, the tongue is going down against the teeth, making the teeth crooked and your jaw narrow, okay? And not going up to the roof of your mouth to make your jaw wide. The roof of your mouth is the floor of your nose, so the wider your upper jaw, the better your breathing. And the more narrow, the more mouth breathing, the more facial pain, jaw issues. That's what we're finding.
And this is, in the literature, supports this?
Well, I just told you we're producing the literature.
Because look, I've had, with the functional medicine doctors, the medical doctors, I've had that mentioned to me that our airway and our jaws are shrinking over the years, but I never got to hear the story like you just told me.
Yes.
Interesting. So it's diet related, and you put them on an anti-inflammatory diet.
Absolutely. Absolutely.
Good for you. So if somebody wants to find, because all of your centers are like TMJ and Sleep Therapy Center of San Diego, of New York, of...
Yes.
So is the best way to find a center near them to go?
To our international website, which is TMJ Therapy Center, and center is spelled CENTRE.com.
And then you can locate.
And then you can find a center near you.
Or if they want to deal with you, the king of TMJ. I'm joking about that. But you have a lot of people that are flying in, flying out.
Oh, I've treated people from all over the world at my office here in San Diego.
Okay, good. I want to thank you for coming on the show.
Thank you. Appreciate it.
Thanks to finally meet you after hearing about you for so long.
Pleasure.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.